I know that the reason why I went into rural medicine was because another physician said, yeah, come see what I do. I feel like it's almost our responsibility to let students see and observe how cool and how fun it is to do our job. It's a privilege, really, what our job is.
The ER component, believe it or not, like you say, you might think that is a burden, but that keeps me from being, quote, the doctor in a box. I actually am the doctor to take care of them all the way through. So that to me is appealing, and it keeps my skills sharpened. And the patients appreciate it because they see their same doctor. They don't go from one doctor to the next.
The care is more personalized. There's much more continuity. We deliver our own patients. So this patient I'm delivering today, I've cared for her entire pregnancy, and I'm here today to deliver her baby, which is an honor, and she loves it, I love it. Like, it works both ways.
One thing that I maybe didn't realize in the rural setting was, I might be putting a cast on a kid in one visit and doing a well woman visit my next patient. So just the amount of things that we do here that some of the bigger family practices in bigger communities, they wouldn't necessarily do, they would send on to the specialist. So we really, I take care of your laceration and then the next person's broken arm. We really do it all.
I think one of the biggest misconceptions about a nurse practitioner is that we don't think independently and that we're the physician's assistant. But we're not. In this setting, we're very independent and we do a lot of critical thinking and decision making independent of a physician.
I think really rural medicine lets you do a little bit of everything, which I think is the most rewarding. It can be intimidating, but it's a really cool thing to do.
I think the thing about nursing specifically is there's so many different types, and that's what's so valuable. You just got to get through school. You can do any of it if you just keep going.
Never assume that you're not smart enough, because my scores were average. My grades were average. They were not anything stupendous by any means, but I had the drive and the passion to be there. I think the folks at KU could see that. So don't feel like just because you can't ace the test that you're not going to be a good doctor or even be able to get to medical school. You can.
Nursing has given people the opportunity, in many cases, to get a 2-year degree, an associate degree, make a decent living, and have, with that education, such a wealth of places to go.
You have to want to be a doctor, you want to help people, and then be smart enough to start that learning process. But you don't have to be the smartest kid in your grade or school or anything. You just have to want to do it.
Asking other people around you, ask your teachers, like, do you think I have what it takes to, if I work hard, how can you help me do this? Because there's people in your world that want to support you. I think my math and science teacher growing up was absolutely like motivated me and inspired me to keep working, and said he thought I could do it, and that meant a lot, and that helped carry me, through, like, okay, he's in my corner, he thinks I can do this, so that helps.
The reason I became a nurse is because I had a daughter that was ill and died. So, and I wanted to be the nurse that took care, that did what she did for me and my family. And so I became a nurse. And then when I started working here, there was a mother who was in labor. This was her second child. Her first child was stillborn. She was very scared throughout the labor process. We connected on a personal level. She's still in the community. We still have that connection. And her child is 18 now. And for a long time, I kept the birth announcement on a bulletin board at my house. That was one of the most rewarding experiences I had, is connecting with this mother during a time that she was very, very fearful.
We had a patient who was on hospice, and needed a particular surgical procedure that really a certain specialist all the way in Kansas City needed to do. She couldn't get to Kansas City. She was also on hospice, so they wouldn't allow for big surgeries to have happen. We contacted the surgeon, and he walked us through everything you had to do for that specific surgery. Dr. Shetler and I felt comfortable after the conversation and knowing our own surgical skills that we could then proceed with that procedure. It took a lot of trust, I think, in each other and trust with the family. But we did it. We were able to do it. And there are some amazing moments that we have the great pleasure to be a part of. That one's a tough one, but something I'll always remember. Just the impact that I know it had on the patient and the family. Very rewarding for us and helpful for them.